start recording. So I hope everybody can hear me okay. I would just like to say thank you very much to Elisa for organising this talk tonight. And it's the first one we've done between us as a online presentation. So please do bear with us if there's any slight technical hitches, but I hope you'll find it enjoyable. I'm just going to start sharing the screen. Okay, now I hope everybody can see that.
Yep, looks good.
It looks good. Good stuff. Okay. I'll just start by giving you a little bit of background on myself, just very, very briefly. My name's Lesley Winton, and I'm the founder and CEO of Fostering Compassion, which is a humane education programme based up in Ormiston in East Lothian. Primarily, we work with vulnerable children who, because of their own difficult starts in life, may have started to show worrying behaviour towards animals. So we work with them to turn that behaviour into caring and compassionate behaviour, and hence trying to play a part in reversing the cycle of abuse and stopping animal cruelty. We have two main programmes that we run now under the banner of Fostering Compassion. One is called Creating Compassionate Children, which covers all of our activities and workshops for children. And the second one is Connect with Compassion, which helps the other end of the age scale, where we work with elderly people who may have been separated from their pets. We also look at the highlighting awareness of the human-animal bond, and of course of the issue of pet bereavement, which is what I would like to talk to you about tonight. No, I can't get that. Is that changing for you, Alyssa?
No, I'm still on the first slide.
Oh, there we go.
Oh, now it's changed.
Has
There's
that
a bit of a
changed?
delay.
Yeah, good. Sorry, I did think there would be a few technical hitches. So I really am delighted to be able to talk to you this evening about the topic of pet bereavement, which is often a very much overlooked area of grief. And I appreciate that many of you are of a veterinary background. You're either veterinary students or you're working in the veterinary profession, and some of you may not be. So I would like to present this evening from the perspective of someone who's been through this type of loss and has a keen interest in raising awareness of the strength of the human-animal bond and how hard pet bereavement can be. So I hope by sharing some of my experiences and some thoughts and ideas for helping others, it will be of benefit to you all. So if I can, I'd like to start by telling you a little bit about my beloved rescue dog, Holly. Holly came into my life in 2008 when I was in a really dark place in my life. I'd been made redundant and was suffering greatly from depression. I didn't know a huge amount about Holly's history, but I knew she was around 4 or 5 years old.
Precious.
She'd had the same number of homes during that time, and she'd been used as a breeding machine and fed rubbish. She weighed a massive 10 stone, which was 62 kilos, so she was the size of a small bear and could barely walk or lift her head. I wonder if the person who's joined could maybe mute their mic. Elisa, have we got someone who's got an unmuted mic?
Lesley, you might be able to mute all as the host, although you probably can't see the... Alexis, could you mute your microphone, please?
Sorry, everyone, if you just bear with us. That's it. That sounds like it. Great. So yeah, Holly weighed a massive 10 stone, which was 62 kilos, and she could barely walk or lift her head. I was determined to help her. So many people said to me how lucky she was to have me, but in reality, I was the one who was lucky to have her. We embarked on an amazing journey together, and the importance of each of us to the other was undeniable. Not only had I lost my job, I'd lost my purpose, my identity, and my feelings of self-worth and self-esteem. It was a very dark time for me. Holly gave me a reason to go on. Her life needed saving, and in turn, she saved mine. Gradually, and with a lot of hard work and visits to the vet, her health turned around and she started to make great progress. We started with very slow and steady walks. She tired so easily. I always had to bear in mind that whatever distance we walked, we had to get back again, and there was no way I could carry her. My neighbours loved her and were in awe of her transformation. She gained an army of fans and even had one favourite neighbour whose house she used to stand outside, stare in the window and bark until the neighbour came out to give her biscuits. We always made sure it was just 2 biscuits and not 3, much to Holly's disgust, but we didn't want to undo all the good work we were doing. As her health improved, she began to unleash her inner puppy, and it was a wonderful sight to see. Being a typical lab, she was, of course, food fixated, but given how far she'd come and how proud I was of her, the first time I caught her up on the kitchen counter trying to pinch some food, I didn't know whether or not to give her a row or praise her for managing to get her feet off the floor. She used to love to sit in between the cooker and the fridge. I think she thought it doubled her chance of a snack. There was one night when it was snowing and Holly was out in the garden. I saw her looking up at the sky, fascinated by the snowflakes falling on her nose, and she suddenly started bounding around the garden like a cross between a rabbit and a kangaroo. It was just wonderful to see. Mind you, she had just pinched some Brussels sprouts off my plate, so it may well have been them propelling her around the garden. She really was amazing, and watching her transformation was a joy to be part of. She had truly stolen my heart. As her health improved, she became more and more mischievous and cheeky, and dare I say, a bit of a diva. At that time, I was working from home, and she always had the habit of pinching my seat as soon as I got up. I remember this day really well. I'd set all my papers out and had everything organised to start work, but I decided I wanted to go and make a cup of coffee. So I thought I'd be really smart and get one up on Holly. So I put my briefcase on the couch so she couldn't pinch my seat, only to come back from the kitchen to find Holly sitting on top of the briefcase. I'm sure she used to play tricks on me too. Her favourite place was lounging around on her reclining sofa, and this day I couldn't find my mobile phone. At some point, I'd put it on the couch and she'd stealthily crept up and made herself comfortable. I'm sure deliberately lying on my phone so I couldn't find it. Well, I did get my own back on her this day when I phoned my mobile from my landline and she got a fright when her bottom started ringing. One day, as her health improved, my mum and I decided to pack a picnic and go to the park to teach Holly how to fetch. It was a beautiful day and Holly seemed so full of beans, a remarkable turnaround for a dog who had been at death's door. We put our picnic down on a nearby bench, then Mum, Holly and I lined up in a row, ready to throw Holly's ball. I said to her that we're going to throw the ball to show her how to run after it. So I threw the ball with all my might, and Mum and I ran off after the ball as fast as 2 people in their mid-40s and mid-80s could. We arrived at the ball and there was no sign of Holly. Her ladyship had thought much better of taking part in our game and had instead hot-footed it back to the bench and was merrily tucking into the picnic while watching the entertainment. She was amazing and so happy. She had so much fight in her, and when given the proper care, a great zest for life. Don't get me wrong, she still had many ailments as a direct result of her previous neglect, including arthritis, spondylitis, thyroid issues, and she was, in effect, in liver failure. But she certainly didn't let these things stop her. Her arthritis did flare up with changes in the weather, and she would go through stages of slowing down, needing to rest, and then bouncing back. I always worried how hard this would make any difficult decisions I had to make in the future, especially when she bounced back so spectacularly from these challenging phases. However, when the difficult day came and Holly hit another bad spell, I knew this time it was different. Holly was really lame and refusing to put her leg on the floor. For the first time in the 5 years since she'd come to live with me, she didn't climb up on the couch to sit beside me, her favourite place. Even on the first day she arrived, she was utterly determined to heave her bulk onto the couch beside me and had done it every day since without fail. This time, she just looked at me with her beautiful, big, soulful brown eyes and lay down on the floor. I knew this time, the time had come for the decision every pet owner dreads. After everything Holly had been through, she'd developed bone cancer. Holly passed away in my arms on the 29th of May, 2013. It is true what they say, dogs give you some of the best days of your life and one of the worst. Although I had suffered the loss of a dog before, the sense of loss I felt from Holly's parting was like no loss I have ever felt before. The house was so empty. I looked for her in all the old familiar places she used to love to lie. I couldn't find her. Her absence was crushing. There were those inevitable moments when you wake in the morning and for a fraction of a second forget your loss. Then the wrecking ball hits as reality comes crashing in. On those days, it took me all my time to put one foot in front of the other. I remember days after letting Holly go, we had relatives visiting from overseas staying with my mother. I was asked to go over and visit, and quite honestly, it was the furthest thing from my mind and the last thing I wanted to do, as they weren't particularly animal lovers. However, I felt obligated to go, so I dragged myself out of the house to drive over to my mum's. I was so brokenhearted and in so much pain that day, I remember it like it was yesterday. As I walked into Mum's house, the first thing my relative said, with unbelievable flippancy, was, "Smile." I couldn't believe it. It was like a knife through the heart. How could she be so disrespectful of my loss? If it had been a human family member I'd lost, she would never have said such a thing. Why was my loss being belittled? Holly was my family, and I was utterly bereft. Holly was an incredible dog. They often say that if a dog has helped you through a difficult time, or if you have an ill dog that needs extra care, the bond between you grows all the stronger. We had both those situations. The significance of each of us to the other was without question. At the peak of her treatments, Holly was on 27 pills a day, eardrops and eye drops. Every morning, our routine was packed, and I would administer all her medication and was convinced at some point I would stick something up her nose that should go in her ear and something in her eye that should go in her mouth. But thankfully, everything reached its correct destination. The emptiness of the mornings after she passed away was almost unbearable. No duty of care, no nurturing, no routine. For nearly 5 years, every day had revolved around Holly and her needs. All structure seemed now to be gone. At times I'd wake in the middle of the night, sure that I'd heard her at the door, needing to go out into the garden, and would be halfway down the stairs before I realised I'd dreamt it. I inevitably replayed the final days in my head, berating myself for not delaying that call to the vet. If only I'd had a few more hours with her. The guilt was horrendous. I felt like I'd murdered her. To me, the decision to let the vet euthanize her was akin to deciding whether to turn someone's life support machine off. That's really what it felt like. The strength of the human-animal bond should never be underestimated, and the pain of that loss is real and very debilitating. Even if people are not animal lovers, no one has the right to belittle a loss. It is never just a dog or just an animal. Loss is loss, grief is grief, and if it matters to you, it matters. Of course, pet bereavement doesn't apply to loss only through death. It can also apply to enforced separation, or they may be stolen or go missing. The elderly can lose a much-loved companion, a way of life, a chance to get out of the house, and it may even be the last link with a deceased spouse. Many elderly pet owners are forced to give up their pets when they have to go into retirement homes. Couples who can't have children very often look on their pets as their babies, their family, and feel any loss acutely. Families fleeing domestic violence situations also face problems, as not many shelters take pets, and they may be forced to give them up or leave them behind. Homeless people may be forced to give up their pets to get accommodation. Many will choose to stay homeless so that they don't have to be parted from their beloved animal. Only a few shelters have adopted positive pet policies. Those suffering from addictions that want to take up a treatment program may be forced to be separated from their animal when they need them the most. And there are the many heartbreaking stories of children taken into care who are separated from their family pet. In many circumstances, that pet may be the child's best friend and confidant in surroundings of abuse and neglect. And let's not forget pets mourning the loss of another pet. They may become very unsettled, aimlessly wandering around, searching and crying. They may lose interest in food and playing and display a need for extra attention. Animals impact on our lives in so many ways. It's no wonder we feel their loss so keenly. They are our best friends, our confidants, babies, traveling companions, final links with loved ones, a way of life providing routine, structure, and companionship. I love this quote taken from an article written by Gail Mackenzie Smith in 2017 for Purple Clover, and I think it beautifully sums up this relationship. It says, human relationships are complex, love given, love revoked, love abused, neglected, tested, stretched. Human love comes with baggage, and that baggage is left here when someone we love dies. We can dig through it, maybe chuck out a few threadbare items away, but that suitcase will never be emptied. But animals have no baggage. They enter our lives pure and unburdened and leave the same way. They love us unconditionally. When Holly's ashes came back, I was so blessed. I had the most wonderful vet who had cared for Holly all her life, and he went above and beyond the call of duty and made sure he brought her home to me personally. And with the ashes, I got a lovely card back from the pet crematorium. On it were some of the most beautiful, inspiring, and uplifting words I've ever read. They said, "Our beloved pets truly are some of nature's finest jewels, dazzling us in so many ways. Always mysterious free spirits, we are privileged to care for their earthly needs. Always remember your precious pet with love. knowing that kindred spirits will, in the fullness of time, be reunited. I, for one, certainly hope so. I hope you've enjoyed that story of Holly, and I hope it helped to highlight the strength of the human-animal bond and how it can touch our lives in many ways. So I'd like to just talk a little bit more about the issue of pet bereavement. If you'd like to add any questions or comments in the chat box, we can have a Q&A or a chat after this. But I'd like to highlight that pet bereavement is very often associated with death, but it can happen from loss in different ways. It may be an anticipated loss. It could be long drawn out, but you know it's coming. It may be a sudden or unexpected loss. It could be through euthanasia, or it could be through natural death. It may be death imposed by law. It could be a traumatic loss, and I suspect there will be a lot of traumatic losses following what we've gone through in lockdown and the pandemic. I know there's some veterinary practices, if there've been 2 adults with the animal, only one can get in for the euthanasia and the other one can then view the body. So at what is such an incredibly traumatic time, it would have been exacerbated by the current circumstances we're all forced to endure. The loss can also come from enforced separation. So the animal may not die, but they may be forced to part. And that could be through admission to institutions, changes in elderly people's housing, other housing regulations where rented property doesn't allow pets and they have to be given up, or of course divorce and separation. The pet may be stolen, it may be missing, it may be terminally ill. So there are a lot of other ways where people can suffer the loss of a companion animal. Now, I put this slide together initially thinking about ways to perhaps give some, hopefully some good guidance to veterinary students, but also I think it's important for pet owners to know and animal lovers to know. I think it's really helpful, and I know it helped me, that if the vet explains the process of euthanasia and what will happen during that process, especially if there may be potentially distressing reactions that the pet owner may not be expecting. For example, last gasps of breath or eyes remaining open. I know Holly did a last gasp of breath, and if I hadn't been warned about that, it would have just been awful. It's so important and so much appreciated by the pet owner if they're allowed time for discussion, reflection, making decisions, and goodbyes. And also consider discussing with them, maybe taking a clip of the animal's fur, possibly a paw print, and perhaps their collar and tag. These are all nice things to be able to do that might be hard to think about during the actual time this is happening. If the loss has been anticipated, try to discuss aspects prior to the actual euthanasia, as during the process it's so emotional, it's hard to concentrate. So things you could consider would be the after-body care. Do you want a private cremation or a communal cremation? A burial? Do you want a casket? Do you want a scatter tube to scatter the ashes? There may be questions after the death, and it helps so much to be patient and compassionate with the pet owner. I know with Holly, the morning after, I woke up in a complete panic and I had to phone the vet to ask where the body was, and he was lovely, but it was just something I could never have anticipated. And I was so grateful for his patience. And for the grieving owner, there's so many different ways of memorializing your pet. You could perhaps create a memory box, a photo album. You might want to write a letter to your pet or write a poem, or perhaps a little memorial garden. Or if you don't have a garden, you could get a special plant in a pot and perhaps even put that pot on wheels so that if you move house, you can easily take it with you. And also, if, of course, you are in the veterinary practice, I think it's so good to be able to have organisations you can signpost a grieving or a grieving owner to. I know in the veterinary practice, the act of euthanasia is very hard on you as well, and you never get used to it. So it takes a toll on you, and being able to feel you have something to give to a grieving owner will be of comfort to you as well as of comfort to them. So I would highly recommend the Blue Cross Pet Bereavement Support Service, who are absolutely excellent. Their helpline is open daily, 8:30 a.m. to 8:30 p.m. They have an email service, and they have started a web chat service. Us at Fostering Compassion, we launched a pet loss a friendship group, which will normally run on a Wednesday night. It is, of course, on hold at the moment because of lockdown, but I'm happy to provide further details of that. And you can download materials from the Blue Cross website as well, and they will send you the business cards with all the pet bereavement helpline information on. Also, as a veterinary practice, you might want to even put together a bereavement pack with these details in them. The owner may not want them, they may not use them, but I think it's a nice way to show the recognition of the scale of this loss. It is a significant loss, and it can be as hard, sometimes harder, to get over than the loss of a human, depending on the relationship. Also, I feel it's nice to try to facilitate the owner staying with the animal, if at all possible. This prevents the animal searching the room for his or her owner at the end and at a distressing time, and knowing the guilt that can come from the owner's perspective, it could help reduce potential guilt. However, having said that, I think it's always really important to respect the owner's feelings. You don't know what's going on in their life. There may be just some reason they just cannot be present. In that case, you may suggest that they could stay until the animal is sedated. So worth considering these things for the time euthanasia takes place. If it's possible, arrange it at the end of the day or during a quiet time. Of course, I know that's not always going to be possible, but if it can be, that can be helpful. And from a grieving owner's point of view, if it's possible, and if the size of the veterinary practice allows, try to show the client out through a different door, so that doesn't involve them walking through a waiting room or a busy reception. And lastly, I've put this picture here because I actually like this, but having spoken to a number of people, it definitely promotes debate. I know some veterinary practices that will have a candle and this little sign up that reads, if this candle is lit, someone is saying goodbye to their beloved pet. We ask that you speak softly and with respect during this difficult time. Thank you for your kindness and compassion. Some people say, if I'm maybe coming in with my puppy, I'm all happy with this new puppy and you're bringing me down. And then other people will say, well, actually, it's a really good idea because I've got a grieving pet owner in a close consulting room and the postman just came in laughing and joking with the receptionist. So I think it's quite interesting, and I'd be interested in other people's thoughts on that as an option to make pet loss a little bit easier. And just to wrap up the presentation, I've been working very closely with SCAS, the Society for Companion Animal Studies. I'm a trustee on their board as well. And we've been producing these joint resources, the Creating Compassionate range, we call it. And these have been put together to try and increase understanding of pet loss and pet bereavement, and to help people find ways to be a little bit more compassionate in this area of grief. And they're called Creating Compassionate Classrooms, which helps teachers understand children in the class that may be going through the loss of a pet. Creating Compassionate Care for Children, which is a pet bereavement guide for parents, guardians and social workers. And the third one in the range at the moment is Creating Compassionate Workplaces, which is a guide for employers in creating a compassionate environment for employees who are going through the loss of a pet. All these resources are available on Fostering Compassion's website. Alyssa is going to put the link in the chat box as well. And just finally, if anybody wants to know a little bit more about Holly and read her story and her amazing story of recovery and joy, it is available on Amazon if anybody is interested in that book. So I hope you've enjoyed that. I'm going to come out of this and then we can start the chat. I think I will go back to Alyssa being the host. If you bear with me. Oops, I've lost her. There. My cost.
All right, thank you very much, Lesley. That was great. So if anybody has any questions now, you can either unmute and ask. If you want to, you can put your hand up by clicking the 3 little dots above the chat window, or you can just unmute yourself and ask a question or a comment if you want, or you can write something in the chat box and we can read it out for you. One thing that I just wanted to mention to all the vet students is I think it's important that if an owner wants to keep the collar of their pet, that we don't take it off until after the animal has passed, because it can be quite worrying to a dog if you take their collar off, because they know that's not normal and something is happening. So it's best if we leave it on until afterwards, and then we can discuss it beforehand with the owner to see if they want to take it home, but it's best to leave it on until after.
I think that's a really good point. And the other thing that's worth considering is when you mention maybe taking a clipping of fur, obviously do that before the animal has gone, before the body has been taken away, because you don't want to suggest that when it's too late. So that's a nice thing to consider leading up to the loss.
Yeah, and Christina's mentioning how it's important for veterinary staff to be aware of their own processing of losing patients, because some of them we've seen every day for months and have been treating for years, and we also have a connection to them. So we need to take care of our own mental health too and support each other in that.
Absolutely. Absolutely. I think that's
Heather's got a couple of top tips that might help. Do you want to unmute yourself, Heather, or you can write them in the chat box if you want to?
Thanks, Alyssa. It was really just to say that I think from a looking back experience point of view, I think all of Lesley's tips regarding how to manage euthanasia were really on point and absolutely useful. I think things like deep breaths. I always say to clients, he or she might take a couple of deep breaths before she passes. Always let them know it will be very quick. A lot of clients are unprepared for how quick the euthanasia process will be. And just be careful about your terminology. So, for example, we might refer to the last breaths in a purely medical term as agonal gasping. Never use that term in front of a client. It's awful. I always just say a couple of big, deep breaths, and it's perfectly normal. I always tell them it's an overdose of an anesthetic solution. That's also true. It's a concentrated thiopentone. It's an anesthetic solution. It just gives clients a frame of reference that they can access, that gives them a level of understanding of the process. It will be just like he's going to sleep for an operation, but we'll overdose the anesthetic and he won't wake up. Make sure you've checked the record. Make sure you know the animal's name. Make sure you know the owner's name. Make sure you know whether it's a male or a female. Sounds really basic. I've seen people that don't do that. It's really uncomfortable. And the last thing is something which I've used a lot of actually during the pandemic, and hopefully I'm hoping it will become more widespread in practice, but something that I really like doing is placing an IV cannula and attaching an intravenous drip line to it that is pre-filled. You can pre-fill it either with just saline or with ether-towel, and that means that you can then sit at a distance of a metre or two away, depending on the length of the line, away from the client. You can put it in a lateral saphenous, you can put it in a cephalic, depending on what's comfortable. But it means the client can sit with their, assuming it's a dog, they can have their dog's head in their lap. If it's a small dog, they can have the dog sitting in their lap. If it's a cat, the cat can be sitting in their lap. And you're not in this situation of a veterinary nurse sitting at the front of the dog and the vet squashed in trying to inject into the vein, and the owner's sort of, you know, inadvertently sort of pushed out towards the back of the animal. You know, it means that the owner has full control of the animal's head and its face, and is able to see their pet in those important last minutes. So I think once everything's set up, having a cannula with a drip line and a port for injection is a really nice way of making sure that the owner has, you know, those important last moments and is completely in control.
Thank you, Heather. Yeah, I think that's a really good point to make, that we need to let the owner be there with the pet and feel close to them, not just have it a purely medical act. Estelle is asking, how do we handle the administrative stuff when an owner has just had to say farewell to their pets, like the bill, for example? So in my experience, ideally, you would deal with that beforehand. So you probably have a recent or accurate enough weight on the animal that you can do all your drug billing and everything like that, cremation bills beforehand, and just get them to pay the bill before you do it, so that once it's done, they're going to be all upset and everything. You can just show them out a back door or another more private entrance, rather than walking through the waiting room and having to deal with the bill and stuff like that. If anyone else has anything else to say on how to deal with administrative stuff around those times, that would be good.
I would just say, if it's a long-standing client, the practices that I've worked for, we will always allow long-standing clients just to leave, and we will phone them a day or two, usually a few days later, 2 or 3 days later. It will vary depending on the practice that you work for and the relationship with that client. You know, so it does vary, but certainly if they're a long-standing client and it's a planned euthanasia, we generally would just let them leave and then phone them at a later date, or they will almost inevitably phone us before we phone them. Most clients, I find, if they're long-standing, want to get their bill paid and want to get that done.
That's a great idea, thank you. Abigail has asked, anything about the room to keep in mind, a setup that works better or helps animals or people feel calm? In the past, I've seen some places are lucky enough to have lots of space in their clinic and can have a quiet room or a specific euthanasia room. But even if you don't have that, just choosing one of your quieter consulting rooms that is away from the waiting room, have like the lights on a dimmer. You could play some soft music if you wanted to, or ask the owner if they want that. Set up a nice cushioned bed on the floor. If it's a big dog, have somewhere comfortable for everyone to sit. Things like that, I think, make a big difference. Does anyone have any other ideas about what you could do to a room to make it better for a euthanasia?
I know when I was going through it with Holly, she was still a big dog at the end. She still weighed about 40 kilos. So when I went in to say goodbye, she had to be x-rayed first, so she'd been sedated. So she wasn't on a table, she was on the floor, but they'd put a lovely little blanket over her. So it was literally like she'd just been tucked in to go to sleep. And I cannot tell you how much that helped me. If I'd walked in and just seen it on the floor, I think my reaction would have been so different. And they had literally tucked her in like she was going to sleep, and I just lay down on the floor beside her while she was euthanized. But that, to me as the owner, made a massive difference.
Yeah, I would agree with that. I would say I'm even in clinical, just normal everyday consults, clinical exams, unless it's a really tiny dog or a cat, I don't use the table. Dogs never on the table in their regular lives, and it can be incredibly stressful for them. And I do not want one of my patients' last moments to be stressed out on a table. So absolutely on the floor. If it's a scheduled euthanasia, if you know they're coming in, as Lesley's already said, ideally the last appointment of the day or a quiet time, a double booked appointment, something like that. Have a bed out ready so that they can just go straight on that, and the dog can go on that. If it's a cat, you might want to consider leaving it in the carrier as much as possible, or certainly having a bed out, just a vet bed or a thick towel or something on the table, just something nice and cozy, so that they're comfortable. Yeah.
Christina's also put a really good point in the chat. Always have nice tissues available. And if you have a phone or something in the room, make sure that it's on mute, like not just your cell phone, but like paging systems within the hospital or stuff that could be very disruptive during somebody trying to say goodbye. So making sure we have a way to mute those or take it out of the room or something is very important.
Definitely. And if you don't want to go down the candle route, as Lesley has mentioned, you know, that they can sometimes be controversial, just communication within the practice team. There's nothing worse than doing a euthanasia and having the receptionist and a vet nurse, because it's the last appointment of the day, and they're just cashing up and they're out at the front at reception laughing and joking while they're doing that. Like that's not okay. So just making sure that there are, I guess, clear expectations within the practice culture around how everyone behaves when a euthanasia is happening. Everyone is mindful of that.
I really think that's great, Heather, and I think it's really important. And I know another memory I have from the day I let Holly go was I was in reception, seated in reception while she was taken away to be x-rayed. And beside me, there was a gorgeous brown Labrador who was wanting to have lots of cuddles. And normally wild horses would never keep me away from cuddling a Labrador. But all I could think about was I can't, because if this is Holly's last moments, I can't go in smelling of another dog. So if a practice is big enough, even a separate room for going in is quite nice as well. It's just, I would never have thought the difficulty would be almost going in. I knew it would be bad coming out, but that was really hard.
I just want to mention before everybody, I see a couple people are leaving, so I just want to mention that we're going to put a quick Google survey on the Facebook event page to get some feedback. So if anybody is willing to fill that out for us, it would be greatly appreciated. We've got a couple more questions. Aisha, I'm not sure how to say it. Any tips for how to manage a euthanasia that doesn't go exactly to plan? For example, if the catheter comes out. It happened to me for the first time today, and I tried to stay calm so as not to make it worse for the client, but I still found it difficult to manage.
Yeah, it's difficult. So well done on managing that. You will beat yourself up over it. You'll reanalyze things. It's completely normal, but all you can do is the best that you can do. My advice would be in those situations, I've had various different euthanasias that haven't gone to plan for one reason or another, is remain calm, remain professional, don't let the client see. So you might be panicking on the inside, you might be feeling flustered, don't let the client see. If you have started injecting already, always be aware that the patient could go into the excitement phase of anesthesia if they've had a small dose of Euthatal. And if they're in the excitement phase, they will vocalize and paddle. So be aware that could happen. If it starts to happen, take the patient immediately out the back. I know that's not ideal, but you need to minimize that. Take them out the back, and the vet nurse, who hopefully you'll have a nurse with you, will deal with the client and reassure them. As you take the patient out the back, make sure you say to the client, this is an excitement reaction to the anesthetic. Don't worry about it. It's perfectly normal. We'll be back in a couple of minutes. What you need to do then is to sedate the animal immediately. So you need to immediately get a vein and immediately get the animal to a sedated stage. Do not euthanize the animal. then bring the animal back to the client so they can see the animal calm and sedated, and then proceed with the euthanasia. It is not an ideal situation, but it's about managing that situation so you don't end up with a paddling, thrashing, vocalizing animal and a hysterical screaming client, which I have seen happen, and it is not nice. It's never happened to me, thankfully. I have had excitement reactions, but it's about how you manage those reactions. You do not want the clients, do not proceed with the euthanasia immediately, because you do not want the client's last memory of their pet to be vocalizing and paddling before you euthanize it, which is why taking it out the back, getting some sedation in there, just some ACP or something will be enough just to take the edge off that reaction, or a bit of propofol will be enough to take the edge off that reaction, so that you can then bring the animal back to the client in a sedated, calm state, and then they can say goodbye and you can proceed with the euthanasia. So that's your sort of absolute worst case scenario. If it's things like not being able to find a vein, or you know, cannulas coming out and not, you know, when you've not injected and you're not at the excitement stage, there are loads of reasons for that. Quite often, particularly with older or sick animals, they'll have low blood pressure. If they've had multiple procedures before, their veins can often be really fragile, veins can blow quite easily, etc., etc. So if you think that that might happen, what I always do, it sounds awful, but I paint a worst case scenario for a client. If I have a patient that I know, for example, has been receiving chemotherapy, or has chronic renal failure, or something that I know has been managed for a while, I'll paint a picture. So as we're planning the euthanasia with the client, I'll say to them, okay, so just to let you know, this is the process. We'll give an overdose of anesthetic, we'll put a cannula, a catheter into the vein. Sometimes that can be tricky to do. He's an old dog, he's had X, Y, or Z procedures done. The veins will be very fragile because of all the previous treatments he's had. So we might need to shave his legs on 2 or 3 places. We might need to try different locations in order to get a vein that we can successfully inject into. I always make sure I've got treats or something available to try and give those to the dog at the same time, and make sure you give the dog a break. It's a difficult situation, and you've got to play each one by ear a little bit. They don't happen very often, but I always find if you try and paint a worst case scenario and then it exceeds the client expectations, that is much better than going in kind of like, oh, hopefully this will be okay, and then having to say to the client, oh, actually, it's not, we're going to have to try this, and now we're going to have to try this, and now we're going to have to try this. So it's about managing expectations, I think.
Perfect. Thank you, Heather. I think it's also a really good idea to have talked through those kinds of things beforehand, so you have some sort of plan what you're going to do if it does start paddling or something, to know that you should take it out of the room and sedate. And I think that's really helpful. The next question is from Kat. Should there be a different approach if you have never seen the pet before euthanasia compared with a pet you have seen often? Heather, do you have any advice for us on that one?
Yeah, sure, I can have a go. Sorry, Lesley, if there's anything that you want to say, just
No, Heather,
jump in at any point.
The medical element. I'll give the grieving owner element. You go ahead with the
I know
medical.
you invited me to be here, but I don't want to.
Fascinating. I'm learning as well.
Yeah, so I think, again, it's very situational dependent. So I have had situations where I've had walk-in clients that the practice has never seen before, that have turned up drunk with a bitch that has a PIO and they've got no money, and they're drunk, they can barely give informed consent, they're borderline aggressive, that kind of situation. You ask them for payment up front and they've got £20 on them in cash, and you kind of know that that's all you're going to get out of them. But fundamentally, it's a welfare issue for the dog. And according to the Guide to Professional Conduct, we have to provide first aid up to and including euthanasia. And so in that situation, assuming I can get reasonably informed consent and I've got a vet nurse witnessing that, just for professional backup, then so that was a situation that happened to me a little while ago. Then I euthanized that dog. I talked to them fairly extensively about options. It was an older bitch. She was already septic. It you know, they weren't in a position to proceed with surgery or management of that condition. And so we went ahead for euthanasia. And I don't think the practice ever claimed the money back. I think we got 20 quid or something out of them. Fundamentally, all practices have those situations where you will have a proportion of clients where you essentially either have to send in debt management collectors, or you write off the bills. And that's up to the practice manager to deal with. As a vet, your legal and ethical obligation is to provide first aid up to and including euthanasia. You cannot refuse a euthanasia on the ground, you know, not in a welfare situation. That's something that, you know, is part of our job. In terms of the actual management of the euthanasia, I actually probably wouldn't manage it much differently. I'd always want the dog on or cat, or, you know, whatever the animal might be, on a bed. I'd always want them to be comfortable. I'd want the owners to be able to stay if they're able to. I would treat each situation the same, because fundamentally it's the animal's experience that matters, and the animal's experience shouldn't change depending on whether you know the client or you don't know the client. But your interaction with the client will be different depending on that situation. So as we said earlier, you might, if it's a long-standing client, you might let them pay the bill later. If it's a client that you've known for a long time, you've probably had conversations with them leading up to the euthanasia and started preparing them for euthanasia. And I would absolutely recommend doing that. If you have, you know, a dog with an osteosarcoma or an anal gland, anal sac adenocarcinoma, it is only going to end in one direction. That is a one-way street. You know, renal failure, it's a one-way street. You need to start preparing your clients. That doesn't mean that when they're first diagnosed, you're in there immediately talking about euthanasia. It needs to be a staged process depending on your relationship with that client. But you need to start dropping it in, because otherwise we talk about treatment and we talk about therapy and we talk about things that we can do. And then all of a sudden there's a decline, and the client is shocked and surprised that suddenly the time has come. So you need to kind of drip feed that information in, and that makes the whole process much easier for the client and for you as a vet managing that euthanasia. And you don't have that luxury if it's a client that you don't know so well. So I personally find clients and pets that I know well emotionally much more difficult, but also after the fact. This is going to sound a little bit morbid, but I find them incredibly professionally rewarding. And I've had people travel quite long distances for me to euthanize their pets, or ask me to travel to euthanize their pets, which I take as a real compliment. But I think it's one of the most important situations that we can do in order to really promote that human-animal bond and to respect, you know, the welfare of our patients and also the well-being of our clients.
Perfect. Thank you for answering that question. There's a lot of good points there. I think the last question we have for now is, has anyone had any positive experiences during COVID when owners were not allowed to be in the clinic with the pets? I guess we're just looking for positives coming out of all our COVID restrictions at the moment.
So the only positive I have is that this again varies depending on, I've got colleagues who work for corporate practices where no clients are allowed in the building. I'm lucky enough to do a bit of work on the side for an independent practice, and I am not comfortable with clients not being present for euthanasias. And so I've been able to have those conversations with the practice team, and we do euthanasias with clients present. They are time limited and the nurse is minimally there. So it's my risk. I'm an adult and I will take that risk. And I use the long line, as I mentioned, the drip line. So if you can take the animal from the client in the car park, you can place an IV cannula, you can attach a drip line to it. You can then bring the owner in a ventilated room to be with the pet. And you can be 1.5 meters to 2 meters away, wearing masks, all that, you know, normal COVID biosecurity, and you can inject, and the owner can be with their pet during even the current pandemic situation. I appreciate not everyone is comfortable with that, and it's an individual decision, but I'm personally not comfortable with the alternative. So I've found that has been something that clients have really appreciated, and it's been nice. Again, sounds very morbid, but it's been nice to be able to do that for people.
Thank you. It seems like a good solution. So if anyone has any other questions, you can feel free to write them in the chat. We'll stick around for another couple of minutes. We're also going to give you Lesley's email address. I'll post it on the Facebook event page. So if you have any questions for Lesley, you can email them there. I just want to say a massive thank you to Lesley for giving up her time to do this talk for us all tonight. And thank you, Heather, for answering so many of our medical questions as well. And like I said, we'll be posting the Google survey on the Facebook page. So if you have any feedback for us, we would really appreciate it. And thanks everyone for coming.
Can I just say as well, thank you to you, Alyssa, and thank you, Heather, for your incredible input. We're very lucky to have Heather on the board of Fostering Compassion, and I think she's really clearly shown that the issue of euthanasia is really tough on vets and veterinary students and vet nurses as well. It's a big issue that can have a huge emotional impact on not just the owner, but on the veterinary practice as well. So just brilliantly highlighted, Heather. Thank you. And thank you, everyone. It's been a real pleasure.
We're just getting a couple of thank yous in the chat, so I'll keep an eye out for any more questions and we'll stick around for a couple more minutes. But if people want to head out, that's all good. Oh, we've got a dog joining us on video now.
Oh, fantastic. The only one we want, the dog.
Oh, he's waving.
He's lovely. We've got rabbits as well, I think, have we? Excellent.
Yeah, I see rabbits.
The stars of the show are arriving now.
We've got a comment that says, something that I've been wrestling with as a student planning on going into production animal practice is how to deal with the loss of animals that are essentially destined for death. I don't want to become callous, but at the same time, I understand the economic realities of my role. I feel that we should treat livestock with the same compassion as pets, but I'm not sure how to do that in a way that respects my own mental health. Any thoughts?
I think that's a really tough situation. I think as you progress through your veterinary career, hopefully, there is a level of compartmentalization, and that's not a bad thing. I am very good at compartmentalizing, and I think it's one of the things that allows me to do some of the work I do, where I actually see quite a lot of abuse and significant animal welfare problems. But you do need to make sure you've got positive outlets for self-reflection and conversation with friends that understand that, not across the dinner table. So it can be challenging. I think one of the things with production animals that we sometimes lose sight of is that even though they are economic animals, certainly my experience is that most farmers do have an emotional connection to their animals. It's not the same as a companion animal, but depending on the farm, there can be, a lot of things that are sort of, heritage connections, families that farmed land for generations, herds and genetic lines that have gone on for generations that are valuable and important, as well as individual animals, depending on the type of farm and the scenario and the people that you're dealing with, there can definitely be an emotional connection there. I think as farming becomes bigger, and you're not necessarily dealing with a farmer or a herdsman, you're dealing with multiple different people in different technical roles, then that does become a bit more distanced. I think it's difficult. I think the important thing to do is to make sure you do have coping strategies that work for you, whether that's, you know, just a decent dog walk or a hot shower or a glass of wine, you know, not a bottle, just a glass. You know, all of those things are fine. You just have to find a strategy that works for you, and make sure that you give yourself the time to process dealing with those situations. I think reflection and skills on reflection. How do I feel? Why do I feel that way? What do I think about this? Why does this bother me? What am I upset about? You know, really drilling down into why you feel the way that you feel, why you think what you think is actually a really important component of resilience in veterinary medicine. So practicing those skills, I think, is important right from the beginning.
Thank you. Yeah, I think it's easy to just go home and either try and forget about it or dwell on the negative parts of it rather than really digging down into why we feel the way we do. So that's helpful. If anyone else has any thoughts on that, feel free to speak up. Or if you have any other questions. It totally depends on the situation, but sometimes I think if the animal seems like they've had a really good life and they're maybe younger than you would hope or something, at least you can take comfort in knowing that they haven't suffered and they've had a good life. So that's something that sometimes helps me depending on the situation. If anyone's got anything else, go ahead.
I would just agree with that, Alyssa. I think as humans, quite often we focus on longevity as being the most important thing, but from an animal's perspective, that doesn't matter to them so much. What matters to them is the quality of their life and the quality of their death as well. So if you can manage those two things to make sure that they have as good an experience as possible, and I know that sounds really weird when we're talking about death, but I think that's much more important from the animal's experience than a long life, which is perhaps what we value more from a human perspective.
I think as well from an owner's perspective, it's very important to think, if you're putting it off, to think, are you putting this off to spare your animal, or are you putting it off to delay your own grief? And I think it's always important to put the animal's needs first.
Yeah, absolutely. I had a case, I don't know if I talk about cases or not, I had a case a few years ago now, which was a client that phoned up asking for a repeat prescription of Metacam for a lame dog. We hadn't seen it for 12 months, so I asked her to bring it in. 12-year-old border collie, brought in, totally moribund, couldn't stand, was flat, was carried in a towel, absolutely flat. Had enormous edema in its hind leg, and what had happened was the dog had had a mammary strip 12 months previously. Had then developed scar tissue that had impeded lymph return back to from the limb back to the abdomen, and had developed massive lymphedema of the leg, which was incredibly painful. Become moribund, stopped eating, and had essentially not eaten anything when I took the history and spoke to the client, examined the dog, massively dehydrated, not eaten anything for over a week. And the owner, I think, had failed to seek veterinary attention because they were concerned about what the outcome would be. And so they just left the dog over a period of time. In that situation, from a personal point of view, for me, it's quite difficult. And I'm sure lots of vets feel this way. You know, you see that dog, you know it's been suffering for a week. Your immediate knee-jerk reaction is, why would you do that? But from an owner's point of view, they're terrified of being judged. They're terrified of losing their animal. They're terrified of what the outcome is going to be. And they're in absolute denial. And so you've got to be really mindful of that. And chastising anyone doesn't help anything. So it was really clear to me the owners were not in a position that they had even considered euthanasia. They'd wanted a repeat prescription for a dog that hadn't eaten for a week and couldn't walk. But I explained to them the dog was seriously ill, very dehydrated. Let's admit her for fluid therapy. So got consent for that, admitted her for fluid therapy. And I said to the owners, she's very, very ill. I really think we need to start thinking about her quality of life and whether she can do all of the things that she needs to do and she wants to do. And we need to start thinking about that. They were like, okay, we'll think about it. And the female owner in particular was very worried about her. and didn't really want to leave. She said, oh, well, I'll get a coffee and I'll wait around in the car park and we'll just see how she's in an hour or so. So got her on fluids. The owner was coming back in every hour or so, just asking for updates. And in the end, what I ended up doing, because fortunately we were a bit quiet, was getting a chair for the owner and sitting her down next to the kennel. The dog was on a drip in a kennel, a walk-in kennel. And I got a chair, sat down next to the dog, and I said, I want you to sit, you're welcome. I said, I want you to, I did. But I said, you're welcome to come in and sit with her. It'd be nice for her to have you here, but also then you can see yourself if she's responding and how she's progressing. Because I thought this owner needs to see that this dog is dying, because she is dying, and there's not really anything that we can do in this situation. She's not in for a week, she's massively dehydrated, she's probably in renal failure, the owners have no money, so I can't take bloods or test for anything. So she sat there for about 3 or 4 hours, and I kept coming, and I was giving the dog pain relief. I was just giving her methadone because of the pain from her lymphedema. And she was having fluids, and I was saying, look, she's, we would want her to, she's hydrated now, we would want her to be brighter. She passed urine. I said, the hydration status is improving, but she doesn't seem to be any brighter. What do you think? How do you think she's doing? And I think just the period of sitting there with the owner, seeing the dog, seeing that I was giving her treatment and the dog wasn't responding, allowed the owner to process the fact that we were trying. The dog was on a drip, the dog was being given medication, she was being given pain relief. She wasn't getting any more alert, she wasn't getting any more responsive, she wasn't getting any brighter. It just gave her the time that she needed to see that there was no response, and it allowed me to drip feed over those 3 hours. She's really not getting any better. Oh, it's a shame she's not responded, has she? Oh gosh. What does she normally like doing? Does she normally like running around? Oh, she's a collie, so does she like, the collies I know, they really like ball throwers and fetching things and chasing things. And she would tell me about the dog and what the dog enjoyed doing. And I was like, oh, it's a shame she can't do any of those things anymore. She's too sick. And all of those things over time, a couple of hours just gave. And eventually I went to check the dog's fluids, and the owner turned around to me. She said, you know what, I really think this is enough. We need to think about her quality of life. And what do you think about euthanasia? And I'd never mentioned euthanasia at that point. And I'd gone within the space of about 2 or 3 hours from an owner who'd come in wanting a repeat prescription for a moribund dog to an owner who was asking me for euthanasia. And it's just about managing that situation. And I was lucky that it was a quiet day and I was able to do that. I've certainly had days in practice where you don't even get lunch, you don't have a drink, you're dehydrated yourself, like you're going from one thing to another. So it was just a really fortunate set of circumstances for me, and I think also for that dog, that we were able to do that. But that's something that really stuck with me, because it was, you can change people's minds, but you have to do it in the right way. You can't force people into that decision. You've got to bring them with you. You've got to take them on that journey, I think.
I think that sounds like a really nice way, rather than just shocking them at the first sight saying this dog needs euthanasia.
Yeah.
And I've also seen
I think if I'd said to them when they first brought it in, this dog's really ill, you need to think about euthanasia, I think they would have picked that dog up, turned around and gone home.
Yeah, which is not good for the dog at all.
Not at all. And so I was aware of that. And so on the inside, I was horrified. On the outside, happy face.
Yeah.
Always a happy face.
And I've seen a similar technique used when people have a dog that's not anywhere near that bad, but is definitely getting towards needing to be euthanized. And a vet once told me to ask the client, what are 3 things the dog loves doing? And then when they stop doing those 3 things, it's time.
Yeah.
And that seems to help people.
Yeah.
Like Lesley said, when they have ups and downs and you're like, well, when is the time? Once she stopped getting on the couch, then that was a clear signal that she's ready.
Yeah. It sounds awful, but don't let owners use eating as a proxy for quality of life, because and especially
right.
for Labrador, I've had Labradors that have eaten black pudding as I am euthanizing them. To me, that's a brilliant euthanasia. Like they've gone out on a high.
Yeah.
But it's, some dogs, less so with cats. Cats are obviously a lot more selective in terms of their food intake, but some breeds of dogs are genetically driven to eat. You cannot use that as a proxy for quality of life. And so I think it's really important that owners understand that. So yeah, thinking about, what does he enjoy doing? What does he enjoy? Does he enjoy going for walks? Does he enjoy sniffing? Does he enjoy, Does he enjoy playing games?
Yeah.
Does he enjoy getting up on the sofa? What is it, and what can't he do anymore? That's really important.
Definitely.
All right, well, I think that's pretty much it for questions. Thank you for all your input, Heather. That's really helpful.
Yeah.
No worries, that's fine.
As always.
My lockdown life now. That's I don't have anything else.
You're on the beach.
Yeah.
I'm not.
Okay.
That's me remembering that's where I want to be.
Aw.
Oh, exactly. We'll get there one day.
Yeah, that's when life returns to normal.
I know. Fingers crossed. Exactly.
Oh, lovely to see you, Lesley. Thank you very much for
too.
organising, Alyssa. It's been, I think, really helpful for all of the students.
Yeah.
So thank you for doing that.
Thank you to you both, because it really has been brilliant, and I've learned a lot as well, Heather. It's really interesting to get it from the veterinary perspective as well.
It's weird. Euthanasias are one of the things, as I said, they're one of the things that I find very difficult to do, but they're also one of the things I find most satisfying. And that sounds a bit weird. I'm aware of that, but I think if you do them properly, they can be, and they go well, because there's an element of luck to them as well.
It's actually beneficial to somebody like me trying to help bereaved pet owners to actually know about the cases that go wrong, because they're going to be incredibly traumatic to cope with.
I think the ones where they go into excitement, I've had that happen once to me, and it was a practice where I was locuming, and they wouldn't allow us to use cannulas because they were too expensive. They're about 26 pence a cannula. That's about how much a cannula costs. Too expensive to put them in for standard euthanasias, so you'd have to inject off the needle, which means you just go in with the needle and the syringe, which works fine in 99.9% of cases, and then every now and then it doesn't. And I had one case where the dog pulled its leg back, the nurse didn't have it restrained properly. Again, I don't like those because you're so close. The nurse has to restrain the dog to lift the vein so that you've got access to the vein, which means the owner can't be by the dog's head. You're in front of the dog's head. The nurse is raising the vein and extending the leg so that you can get the vein. The poor owner's at the arse end of the dog, and the dog pulled its leg back from the needle, and just as I'd injected a little bit, and it was a tiny dog, so that little bit was enough to send it into excitement. And I think that was probably my worst euthanasia experience. It was awful. Took it straight out the back, tried to reassure the owner, but it's paddling, and they paddle and yowl, and they're unconscious. They've had enough drugs to be like trippy. They're tripping out essentially, but not enough drugs that they're sedated. And it's not a conscious reaction, but it looks awful from the owner's perspective. And so I think for owners who are bereaved, if they've had that experience, it's really difficult. I had a really long conversation with the owner afterwards, and did as much damage limitation as possible. And she was as fine as she could be about it. But it's something I won't ever forget, because for me that was my worst euthanasia experience. It was awful not for the dog. I don't think the dog knew what was going on. I had no idea. But for the owner, it was awful. So
and as I think you and I have had a conversation before, you never get used to it. You never get used to euthanasia.
No, because everyone is individual and they can always go wrong. There's always a level of tension about them, and they're always important. So
and it must be tough for you as well, especially if you get very attached to the animal. If it's an animal you've treated for many years, it must get tough.
It's really tough. And I've actually had situations as well on the flip side of that, where I'm locuming and I go to do a week's locum, and I have 10 euthanasias of long-term cases that are scheduled for the week that I'm there. And it's because the vet that works there it's actually really struggles with euthanasias, and she saved them for me, which is
that's really kind of it, isn't it?
Isn't it? It's freaking miserable. But I understand why she's doing it. It's to safeguard her own mental health. It's because they are long-term patients that she's dealt with, long-term clients that she's dealt with, and she really struggles with the emotional burden of saying goodbye to those long-term patients. And I totally understand that. It doesn't make it any easier for me, but I understand that it's probably easier for me than it is for her. But again, from the client's point of view, I always feel a little bit, not the person that they know as well as they know her, and so that's a bit tricky, I think.
And I
sometimes.
think that's something that makes it so much easier for an owner if they know the vet and have a good relationship with the vet, and then they can trust them completely at the end. Because I knew my vet had done everything in his power for Holly, and I knew without a doubt if there was anything else he could do, he would have done it. So that made, you know, I didn't question him, and I trusted him completely, so that really helped.
Yeah, it does. I think it's about having that trust. It's you know, a bit like the case that I just mentioned previously with the collie, where they only came in and sat. I didn't know that owner. I didn't know from Adam. It was actually a Vets Now case. It was a out of hours case, one weekend that just happened to be quiet. So she had no idea who I was. I had no idea who she was. But we built a relationship over that 2 to 3 hours, and was the only reason I was able to then get her to trust me to euthanize her dog. And it's that trust, that relationship is so important in that decision making. And I also think in terms of assuaging feelings of owner guilt, because owners will quite often feel guilty about euthanasia. But I think if they feel like they've done everything and their vet reassures them that they've done everything,
Definitely,
that can be really helpful in assuaging those feelings of guilt. So I think that's quite important as well.
Yeah. I
always try and tell people when they bring me a pet for euthanasia, I will always try and say to them, you've made absolutely the right decision. There's nothing else you could have done in that situation. You've made the right decision. Yeah. Sometimes, even if I don't think they have made the right decision, I will tell them that they've made the right decision, because that's what they need to hear. Yeah. So,
very comforting.
if I think they've left it too late, I'm not going to say, why didn't you bring him in last week? It's not helpful, is it?
It just makes a bad situation worse. But yeah, absolutely. I think it helps with the inevitable guilt. If the edge can be taken off that really helps.
Yeah.
Fantastic.
The thing that came up actually quite recently, Lesley, that might be something worth adding to your top tips is just around sympathy cards. So I totally agree with you. Hair clips, paw prints, if you can do a paw print, clients love those, and it's a really nice touch, I think. And sympathy cards are really nice. I would just say, try and make sympathy cards personal, not in a write your life history way, but in a get the vet to sign their name in it way, rather than just and say the pet's name, dear Mrs. Smith, we're very sorry for the loss of Fluffy.
Yeah.
You know, best wishes from Heather at the practice.
Yeah.
You know, rather than there's a thing on a veterinary Facebook group recently about an owner that had actually complained to a practice because they'd got a sympathy card, and all it said it was a very generic sympathy card, and in the card all was written was from the practice team. Yeah. And that was it. That's all they'd written was from the practice team. And it was like, oh, somebody's just got a pile of sympathy cards and written from the practice team in all of them and then posted them. It just felt very generic. So just taking an extra few seconds of your time to, you know, to, even if, sounds awful, even if the receptionist writes the cards and the vet just comes and signs their name in it, but just making sure you've got the owner's name, the pet's name, and a person that has signed it, I think is quite important. Yeah, I think that makes a big difference. Absolutely. Just the personal touches.
Yeah, one of the clinics I used to work at, we had like a box of sympathy cards, and every week or so they would get sent out and new ones would come in. And when there was like quiet time at the clinic, everyone would go over and look at them and sign them. If you knew the pet, you would write something about what kind of pet it was. He was so nice. And the vets would always sign it, especially the one who
I mean, certainly as a vet, I want to sign a sympathy card for a pet that I've been involved in. Yeah. It matters to me. So, and I know lots of vets and lots of nurses feel the same way. So I think just taking that little bit of extra time to make sure they're more meaningful is quite important. Otherwise it's just a tick box exercise. Otherwise it doesn't make anyone feel better.
Yeah, exactly. It was a waste of time if you're not making it personal.
Okie doke. Right, I'm gonna head off then if there's no other questions. I think.
Sounds good. Thank you so much.
All right, lovely to see you. Thanks very much for organising again, Alyssa. You've done a great job. You're still recording, by the way. I don't know if you want to record all the chats.
I'm just going to switch it off. I'll switch it off just now.